you're really not feeling well today. Okay. Yeah, just keep looking. I'm just looking around. Yep, I'm just having a look at this one side. I noticed that your pupil is not quite as reactive. So look right here for me. Just gonna, yep, so just measure right here. And slight fluid buildup in this area. Does it feel the same on this side? Okay, and down here on your face, that feels the same as here? Any tingling with that? No, it feels okay. Okay, all right. So we have a 1 o'clock. I already did the intake for this patient. Okay, perfect. Oh, okay, so I still have to do the intake for patient in room 7. You ready? Yeah, you can send him in. Thanks, Tara. Hi. Yeah, thank you so much for coming in. My medical assistant just let me know that you arrived. Absolutely. You're just a couple minutes early. That's okay. Are you okay? Oh, you're really not feeling well today. Okay. No, that's okay. What's going on? Okay. I was seeing that in your chart when I was prepping for your appointment, but you feel like it's getting worse. Okay. I see. Okay. I'm just going to pull your chart up while we talk, okay? Mm-hmm. So it's been like 3 days. Okay. Now, is that since you initially? Okay, I see. Dizzy? So you have had blurry vision today, and that's new. Okay. Did you drive here? You did. Okay. And did you feel okay while you were driving? Just dizzy. Okay. Mm-hmm. Nauseous? Okay. No, don't be sorry. That's okay. I'm sorry that you weren't feeling well. Yeah. So we definitely need to have a look. I'm concerned about the dizziness and the blurry vision specifically. That is a little bit worrisome. especially since it's been 3 days. I would hope by now that your symptoms would start to dissipate just a little bit. So I do think we need to look into that. I know you were coming in for a follow-up, but it sounds like you're just kind of feeling worse. Yeah. Okay. So I would like to go ahead and get started with your appointment then. Can I ask you a couple of questions about like the initial injury? Yeah. Okay. All right, dear. So let's see. It looks like it happened, it's about 3.5 days ago. Okay. And what exactly were you doing? Like what transpired? I see. Okay. But you have been feeling like maybe a little bit clumsier lately? Okay. Now, did anything happen prior to this? Like, no? You know for sure that you hit your head? Okay. Did you black out at any point? Any loss of consciousness? No. Not that you remember. Okay. Was anyone else there with you? Was it witnessed? Okay. That's okay. All right. And you did have an initial inspection done. They called an ambulance. Okay. They didn't take you to the hospital then? Okay. Did they mention at any point that you might have a concussion or mild? That was about 10 years ago? Okay. So you feel kind of the same symptoms that you had when that happened. I see. Okay. All right. Can you tell me what your pain level is right now? About a 5. And then is that? Okay. So I do see some bruising there. Yeah. Is it just the front of your head? You did hit the back a little bit. Okay. I'm definitely going to have a look. I want to do some palpations. I'm just going to feel around a little bit. I apologize if it's still tender in the area. I do just want to make sure that the swelling isn't anything super concerning. Yeah. Especially with the blurry vision. Okay. Okay. Any other symptoms? Any numbness or tingling of your extremities or like your fingertips? No. Any floaters in your vision aside from the blurry vision or like loss of vision at all? Any loss of hearing or ringing of the ears? Okay, so you feel like they're just like full. Okay, so kind of like when you get water in your ear. Okay, so I definitely want to have a look in your ears and make sure that there was no perforation of your eardrum. Yeah. So have a look at that as well. Okay. Any other symptoms that you think I should be aware of? Have you been sleeping okay the last 3 days? Yeah. Just headaches. Okay. And do you usually have headaches? Not this bad. Okay. All right, dear. I do think we should get started. I'm a little bit concerned. I'll be honest with you. I don't want you to worry just yet. So we're going to have a look at everything. I'll do a thorough inspection, test some of your cranial nerves, essentially just look at the function of your brain, make sure that nothing was damaged significantly, and then we'll kind of go from there based on what I see today. Okay? Yeah, everything's going to be okay. Let's have a look. All right. Let me just wash my hands before we get started. Can I get you anything? Do you need some water? Okay. Why don't we go ahead and begin? I'm going to do a bit of a light inspection with your eyes. Now, I know because you're kind of having the sensitivity, it's probably not going to be the most comfortable, but I do need to test your pupillary reaction as well as just have a look at some of the vessels in your eyes and make sure that there's nothing more serious happening. The blurry vision right now is my main concern. Okay, so I'm going to start with a more mild light. It's a blue light. It's kind of bright. Just try to look at me if you can. Relaxed eyes. Don't stress it too much. If you need to blink, that's fine. Okay. So I'm going to come in just a little bit closer to you, and then I'm going to be touching your face and kind of moving you around a little bit. Okay. All right. look at me or you can look behind me. Either is fine. Coming in with the light here. Just keep looking. I'm just looking around. So I do see a little bit of abnormality about there. Does that hurt? It's like sore. Yeah. I'm going to come up from the bottom if I can have you look up for me. Perfect. Yep, so let's just keep your head. Perfect. Same thing from the top. You're doing so well. I'm so sorry. Okay. Good. Okay. So this time I'm going to go in with a brighter light. Okay. So I'm going to use my pen light. It's fairly bright. I apologize, but I just want to have a look. Okay. All right. So again, just look at me. Coming in from the side. Just having a look at this one side, I noticed that your pupil is not quite as reactive. So look right here for me. Here. Very dark, yeah. So that's normal. As I bring the light in, your eyes are trying to react. But I am seeing a delay here on this side. Do you feel a difference there? Just look here for me. Now if you follow the light with your eyes. Yeah. So we're going to keep our head straight. And then just follow with your eyes. Try not to move your head, okay? You see it here? Good, okay. So we're just going to follow it. Just this way. Good. You're doing good. That's okay. Coming up from the bottom. Coming up from the top. Just keep following for me. I'm going to go in a circle. Follow with your eyes. I'm going to bring it in. And bring it back out. Give your eyes a second to focus. That's okay. Get double vision a little bit. Okay. All right. So now I'm going to have you look. So I'm going to have you look at. Use my pen. So I want you to look at my pen. Now look at the light. Good. Look at my pen. And look at the light. Okay. So that was a little bit better. Do that on this side. So this time I want you to look at the light. Good, and look at my pen. Good, keep looking at the pen. Yep, just keep your eyes here. Very good, you're doing so well. Look here at the pen. Okay. So sorry about the noise. We just had an emergency case come in, and unfortunately we're right by the emergency room. I know it's a little loud. Hopefully it's not making your headache too bad. Okay. I just want to have a look at your head as a whole. Now I do notice the bruising there by the brow. Get a little bit of an abrasion on your cheek as well. Yeah. Okay. And that's where the pain is kind of isolated to? Just looking to see if there's any sign of really abnormal deformation here. I could just have you turn your head for me. Okay. And then the other way. Okay. Just a little bit concerning there. Are you having trouble with the focus of your vision? Yeah. Okay. All right. Almost done with your examination, dear. I just want to feel around here. I'm just going to measure that one area quickly. So just calipers. Just going to allow me to measure that abrasion, a little bit of that swelling. So you do have a pocket of edema here. Just gonna, yeah. So just measuring here. And slight fluid buildup in this area. So let's see, that's about 1.25 inches there. So I just want to test to make sure that there's nothing neurological going on there. So I'm going to touch you with a cold object. It's very, very cold. And I want you to tell me if it feels the same coldness on this side versus the other side. Okay? So if I touch you here, can you feel that that's pretty cold? Does it feel the same on this side? Okay, and down here on your face, that feels the same as here? Good, okay. If I put some vibration here, you feel that that's vibrating? Does that feel the same vibration here, or is it different? It's about the same? Okay, that's good news. If I test something really sharp, so this is very, very sharp. It's not going to hurt you, but it's slightly uncomfortable. I'm just going to roll this along the area. I want you to just tell me same thing if it's the same. Okay? Does that feel pretty sharp? Same sharpness here. Same here. Any tingling with that? No, it feels okay. Okay, all right. All right, well, I think that is going to conclude this portion of your exam. Now, I think what I want to do is get you over to CT. Yeah. I just want to have a look at your head internally. Make sure that there's nothing more serious going on with that bone structure. Definitely have a concussion. I would say more moderate than mild. So the pupillary reaction was just a little bit delayed, and that does have me kind of concerned. Of course, the blurry vision, I think, is secondary to the concussion, and it will likely heal. So let's go ahead and get you over to CT. I'll walk you over there, and then once the results come back, I'll see if we want to do any further testing today. Could possibly be looking at referring you to a neurologist. I don't want you to worry just yet, okay? Okay. All right. Let me run over and call them, make sure they have an opening in the room, and then I will come back and get you and we'll walk over.